Hi, I'm Lee Siling from the Fit for Life desk of The Star, and I'm here today with Dr. Kamarul, who is the Head of Infectious Diseases at the Pediatric Institute of Hospital Kuala Lumpur. Good morning, Dr. Kamarul.
Good morning to you.
Yep. We're going to be talking about H1N1 today. Dr. Kamarul, maybe you could tell us a bit about the current situation of H1N1 in Malaysia. It's been 6 months since we first started seeing cases coming in. So what's the current status now?
Well, the current status is, the first case that we had was in May. Basically, it was people coming back from overseas, but then we went into the mitigation phase because you have got local transmission. So at the current moment in the hospital, we don't have much patients admitted, and the ones we admit are those with ILI-like symptoms, which is influenza-like illness. Basically, it's in the nadir, which means it's on the trough, but it's there. We will have to wait and see, because the flu season is coming, or we are already in the flu season in the northern hemisphere. So we are actually seeing the trend, and we're looking at the statistics. It's not up yet at the moment.
Okay. So you mentioned the flu season in the northern hemisphere. Would this be the second wave that everybody is talking about?
Interesting term. Malaysia is in the tropical area, so we are hot and wet. So flu is all the time. Just that we are in the northern hemisphere, and in the northern hemisphere, in autumn winter is usually the flu season. So basically, it's around this time where the flu A virus transmits and spreads from people to people. And the flu virus is transmitted by big droplets, which means anybody who is in contact with a person who has flu within 1 meter, which is within 3 feet. And when the person coughs or sneezes, then the virus spreads through droplet and gets into the respiratory tract system. So in that case, that's where you get people with flu-like illness, which comprises of fever, cough, runny nose, and sore throat. So basically, now even in my own household, now I got my own children now having fever and coughing, runny nose, and sore throat. So basically, the season is on.
Mm-hmm. How much would you say the season in the northern hemisphere will affect us in Malaysia? How much of it is going to travel to Malaysia? Is this a big problem for us?
Well, the whole world is actually a small world nowadays. I mean, you can be in the United States in the morning, and by midnight you'll be in Malaysia. And with air travel, now everyone can fly. So you can be in Stansted 13 hours ago, and in within 13 hours you'll be here. And the virus travels in the body of the infected person. And if the infected person sneezes or cough and doesn't follow social etiquette, of course the virus will spread to the person nearest to him or her within 1 meter or 3 feet. And if that person is infected, within the next 10 to 14 days, he will spread to whoever who is in close contact with him. And that's how the flu virus spreads. And, when it comes to Malaysia, of course, it will spread to the local people.
Okay. So, a lot of people are talking about the previous flu pandemics in which a deadly second wave emerged because a more virulent strain emerged from the existing strain. Is there a difference between a second wave caused by a new virulent strain and this second wave that we are now talking about?
Okay. The interesting thing about flu A, it is a virus which mutates easily. That's reason why you can actually treat it quite effectively, because it mutates every 6 months. And on the virus there are what you call glycoproteins, and in influenza A you have got 2 glycoproteins, the hemagglutinin, which we have 15 subtypes, and the neuraminidase, and we have 9 subtypes. So mutation point causes a shift in the virulence of the virus. So every 6 months the virus mutates. So if it's gone through a drift or reassortment, a major shift in the genetic makeup, then the virus develops into a novel strain which none of us is immune. So when that happens, and nowadays with air travel, people get into intimacy, people go to crowded and public places, of course it spreads like wildfire. So there's reason why in the flu A season, we are bound to get infected.
Okay, so basically it might mutate and be more virulent, and also there's just going to be much more of it in Malaysia.
Well,
Soon, coming soon.
I can say
Okay.
so. Because if you look at the Spanish flu outbreak in 1918, it was caused by H1N1. And the second wave was the one that wipes out about 40 million people on the face of the earth. And half of the world's population was infected with the Spanish flu epidemic in 1918.
Okay.
So it can occur, but we have to be vigilant on it.
We'll be right back with more questions for Dr. Kamarul. Yeah. I guess we can go on talking now. Yeah.
Good question.